Having issues with your feet can paint a pretty unpretty picture. Not only can it be painful, but it can be unattractive as well. But if you are suffering from podiatry issues, suffer no more thanks to help from Podiatry Associates and Dr. Scott Woodburn. Dr. Woodburn, welcome.
Thank you.
So glad to have you here.
Glad to be here.
So you've been in the business 30 years.
Yep.
What is the issue that you see the most of when people come into your office?
We see lots of hammer toes, bunions, heel spur syndrome, bad nails. Those
Yes.
are probably the top four.
And they all come to you when it pretty much is a problem, not
Oh yeah,
before.
people like to wait quite a while. It's going to go away. I thought it was going to go away, and it doesn't, so they come in and see me.
And I know one of the things that you see a lot of are bunions. That's
Yep.
pretty common, right?
Very common. It says, I think the research shows that 2/3 of all adults will get a bunion during their lifetime.
2/3.
2/3 of American adults.
Wow. And so what are some of the myths that you have to clear up for people when they come in with a bunion and you're saying, like, that's not why you have it?
Yeah, everyone thinks it's the shoes they wore when they were a kid. It's the high heels, the pointy toes. You know, my mom always put me in too short of shoes, that kind of, no.
Yeah,
It's all hereditary.
And we're seeing a big one
And there is that's a severe. We rate them mild, moderate, and severe. That's a severe bunion.
And so that is through no fault of her own. That's
Nope,
not because
nope.
of shoes she wore or she was an athlete.
Nope.
So how do you get them?
It's passed down through your genes, okay?
Blame mom and dad.
That's right. Mom, dad, grandparents can skip a generation. Wow. So, yeah, it's hereditary. Now, shoes can make it worse, no doubt about it. They can progress the bunion, but they don't form the bunion.
So when they come in and they're in pain, obviously, especially something like that, what do you tell them? What are some of the treatments that they can use to alleviate that pain?
Well, there's conservative and surgical treatment, but there's not a whole lot of conservative treatment. It's either wearing a wider shoe, which you've probably already done,
right?
Okay, non-steroidal alignment, Motrin, Advil type of medicines, sandals, you know, something that doesn't push on it, but that's about it. The strappings don't work. The paddings, people see advertisements about things, straighten your toe, wear this for 5 nights, doesn't work.
It doesn't work.
Doesn't work.
So surgery is probably the best bet.
Surgery is the best bet, especially if it's bothering you and changing your lifestyle.
And it can change your life for the better when you get this surgery. Can you talk about the surgery?
Oh yeah, so surgery, actually most of my surgeries for bunions are the mild and moderates, okay? It's not as painful as people think, okay? We've come a long way. We've been doing bunion surgery for 100 years. We've really perfected the technique. So it's not as painful afterwards. We use some nice medicines that keep the pain down. You follow our instructions, and pretty much it's a clear healing course. You're back into tennis shoes, maybe 4 to 6 weeks.
Wow.
So
Show us talk about what we're seeing here. So this is is that a mild then? A mild bunion?
This would be mild to moderate.
Okay.
Okay. And you see the before. Now, a lot of people think that bunions are actually a growth of bone on the side of the foot.
Yes.
It isn't. It is a shift of the first metatarsal away from the second metatarsal.
Oh.
The further it shifts over, the bigger the bunion is, and the more we need to correct it.
So for the layman like me, it's that long bone has just sort of shifted out.
It's just shifted out. It's shifted away from the other 4 bones that are nice and straight. And as it shifts out, the bunion gets worse.
And so you shift that back over, and what do I see there? Nails there?
So those are small screws.
Screws. I shouldn't say nails. That sounds terrible.
That's okay. Screws.
You can tell I'm a layman.
So what we do is we cut the bone and we shift it over. You can't go in, and a lot of people think, oh, just trim off the bump.
Right.
It doesn't work because it's not a bump. It's a shift of bone. So we cut the bone, shift it over, put 2 small screws in, usually 2, sometimes 1, and that realigns it so that it doesn't come back. If you don't realign it, okay, that bunion's going to come back.
It's fascinating stuff, and I know it affects a lot of people, many of our viewers. If you are interested in getting more information, you can go to podiatryassociates.org or give a call, 410-828-5420. Thank you so much for being with us.
You're very welcome. My pleasure.
And we'll be right back with more Midday Maryland right after this. Stay tuned.